Happy day to all. Welcome to Physiotherapy Competitive Exam Series. Contact details for license exam crash course are given in the description. Orthoses are commonly categorized into two types, static and dynamic, primarily based on the extent of joint movement each type permits. Which of the following statements about static orthosis is incorrect? A. Static orthoses do not allow joint movements. B. They are primarily prescribed for patients with weakened muscles. C. They serve as rigid supports in cases of fractures. D. They are used to facilitate eventual joint movement. The correct answer is B. For patients with weakened muscles or limited control of the neuromuscular system, dynamic orthoses are given, not the static ones. In contrast to dynamic orthosis, static orthoses do not allow joint movement. This type serves as rigid support in fractures, inflamed tendons, and soft tissues and nerve injuries. They are also used to promote eventual joint movement through serial or progressive orthosis. A series of clinical tests are performed on a male newborn. The examiner evaluates the child's hip one at a time to check for an unstable hip. The examiner starts by placing his thumb over the child's inner thigh and index finger over the greater trochanter. The child's hip is abducted and gentle pressure is applied over the greater trochanter. The examiner performs which of the following tests? A. Ortolani test, B. Barlow's test, C. Galeazzi's sign, D. Thomas test. The correct answer is A. Ortolani test. A positive sign is indicated by a clunk which is felt when the hip is reduced into acetabulum. Barlow test is also performed to detect dislocations or subluxations in newborns. But this test is performed by applying gentle posterior pressure to the hips. Galeazzi's sign is performed in infants older than 3 months. Thomas test is used to evaluate for hip contracture. A 55-year-old female complaining of cervical pain that radiates to the right lateral arm and forearm is suspected of cervical spondylosis. On physical examination, the pain in the right lateral arm and forearm is aggravated by lateral bending of the neck toward the side of pain and neck extension. The patient is positive for which of the following tests? A. Lhermitte's sign, B. Hoffman's sign, C. Sperling's test, D. Adson's test. The correct answer is C. Sperling's test. A Lhermitte sign is manifested by generalized shock sensation with neck extension. Hoffman's sign is noted with reflex contraction of the thumb and index finger with nipping of the middle finger. Adson's test is considered positive if the radial pulse is decreased or absent with abduction, extension, and external rotation of the upper extremity at the shoulder joint. A patient complains of pain and snapping in the medial region of the groin. On assessment, the symptoms are reproduced by active and passive flexion extension of the hip. An audible snap is noted with the extension test. The patient is most likely diagnosed with A. Iliotibial band syndrome, B. Piriformis syndrome, C. Iliopsoas bursitis, D. Meralgia paresthetica. The correct answer is C. The patient is most likely diagnosed with iliopsoas bursitis. Iliotibial band syndrome is characterized by pain in lateral hip, thigh or knee and positive Ober's test. Piriformis syndrome is characterized by pain on active external rotation and passive internal rotation of the hip. Meralgia paresthetica is manifested by abnormal distribution of lateral cutaneous nerve on sensory assessment. I hope this video would have been useful to you all. For more such videos, stay tuned to our channel. Thank you.